On today's podcast, we've got Dr. Yusra. She was absolutely incredible. She was just an absolute powerhouse, speaks so well, so articulate. You can tell she's got a scientific background. What did we talk about? What didn't we talk about? We spoke about injectables, but not just we're talking about beauty trends. We're talking about regenerative medicine and how to keep your skin healthy as you age. We talked about lasers and facials. And we also talked about the psychological impacts and emotional impacts of perimenopause and menopause. And unbelievably, why fish testicles are the latest, greatest trending fad. Enjoy the chat. So today on the podcast, we've got the beautiful Dr. Yusra.
Thank you. So nice to be here, finally.
I know, finally I get to meet you. So I felt like we were having a chat before the podcast and we were actually doing the podcast. So I didn't want to tread on toes. So we might as well record it and do it. So Yusra, tell me how you've got to the place in your life and your career and what you're doing now.
So I am an aesthetic practitioner. I have a clinic in Liverpool, in Blundell Sands and Crosby, and also in Harley Street in London. So I travel and shimmy between the two. I have 3 children. And my journey into aesthetic medicine, I think, really started when I was 8 years old. I had an accident when I was 8 years old that resulted in a huge cut to my lip, and I needed surgery to fix that. And it was very obvious as I was growing up. So a lot of people would always ask me, what's wrong with your face? Which was, interesting.
That's amazing because I can't see anything. I wouldn't even notice. I was literally looking at you thinking, you've got the most perfect lips ever.
Oh, thank you. That's so kind. So no, it was very obvious when I was growing up until I had treatment to reduce the scar. And then when I was 16, I got horrendous acne. And then I struggled with that and acne scarring. And then when I was 19 years old, I developed an autoimmune condition called polyarthritis. And that was probably the most challenging time of my life. And that really, I think, was instigated by a whole host of different reasons, primarily stress. I was a second-year dental student. I had just met the love of my life and my dad was completely against us getting married.
Right.
So there was lots and lots of going on. It was also Iraq war. My father had to leave the country to go and help there. So it was really, really stressful. And I went from being this super independent doer to being completely dependent on others to change, to dress, to undress, to go to the bathroom. And I was treated at that time with steroids to reduce the inflammation in my body to manage. And I took steroids for 9 years. And I did 2 degrees, one in medical science and management of healthcare organizations at Imperial College in London, and the other was in dental surgery in King's College London. And then I became board certified with the Royal College of Surgeons of England and Edinburgh. And it was go, 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 go. And by the time I had my first child, I had a scan that showed that I had something called T-3, which is severe osteoporosis in my lumbar spine.
Right.
So at 28, I now had arthritis and I had osteoporosis. So I was stuck kind of in this, my mind was going at 100 miles an hour in my body.
And that can't bode well for carrying a baby when you need your bones and your physicality to be as strong as it ever can be.
Absolutely. Which is why at the time my doctor said, no more children. And I think that's one of the most painful things is being told you can't have children.
Yeah.
And I remember crying myself to sleep for a really long time. And my best friend at the time was working for the Harley Street physician group. And she said, just come and see this doctor. And I went to see him. And at the time I felt hopeless. And I mean, I thought, right, my life is stuck with medicine and that's the only way I'm going to function. And I was busy already. I had started my first clinic in London. And this guy was incredible. And he just listened and gave me something that no other doctor gave me before, which is time and hope. Mm. And that, I think, was instrumental in shaping how I run my practice now. I don't do a one in, one out kind of clinic. My consultations are 1 hour long and I spend time getting to know my patients. And I think that's really, really important. So after that, I didn't take steroids. They wanted me to take medication called bisphosphonates, which stop cell turnover, bone turnover. And that would have meant no more children and really a lifelong dependency on medication. And I went down a route of medicine called functional medicine, which essentially is lifestyle medicine, so to speak. So changing my diet, my lifestyle, how I manage stress. And that has been absolutely instrumental in how I treat every single patient that walks through my door now. So
what were the kind of strategies you employed at that time?
So he at the time told me, he really delved into my diet. And he said, look, do you eat well? And I went, yeah. And he goes, okay, Talk to me about what you eat. How do you cook? Do you have tin foods at home? And he completely bans me from cooking with tin food. That means no tinned, chopped tomatoes. He said to me, where'd you get your eggs from? I was like, Tesco. And he goes, no, you got to go to a farmer's market. You get organic eggs. And he said, and you keep the eggshells and you boil them. You dry them in the oven and then you break it up and you use that as your calcium supplement. So there is so much medicine in our foods. If we know what to eat, actually there's so much out there that can reduce inflammation, that can enhance your calcium in your body. So before I was taking calcium tablets, now I take calcium from eggs, organic eggs, and now I actually have 6 chickens in my backyard. So
it's absolutely true. And I always say this to people, I'm like, your diet has the biggest effect on like the bioterrain of your body. 100%. And it literally is the difference between, how you feel, your mood, energy level, how you look on the outside. Yeah. Like you are literally, when you're choosing a meal, you're actively taking a step in your healthcare, really, or 100%. Not.
Yeah, your food is medicine. And I think you are what you eat, they say, right? And what you consume can actually increase inflammation in your body or decrease inflammation. So I learned about all of the power of that. And then also stress. I am a 100 miles an hour kind of woman. I run 2 clinics. I lead a team of 20 doctors. I teach, I speak globally, nationally and internationally. I have 3 young children. So I am go, go, go. But I now know the power of no. So when there is too much on my plate or something doesn't fit with my goals, my aims, I used to be I'll do that and I'll take that on and I'll take that on. Now I'm very much conscious of minding what's on my plate and my bandwidth. And if something doesn't align or if something is going to tip me over the edge, then I go, no. Like the other day, I was supposed to go to Dubai, all expenses paid to go to a conference. And it was a wonderful opportunity. And I thought, actually, I'm going to Dubai again to speak in 3 weeks. This is too much. And it's going to offset my balance in life. And, I am really passionate about what I do at work, but I'm also really passionate about being a present mother. And that work-life balance is, really difficult, as you know. So I picked up the phone and I said, I'm really sorry, I'm going to have to decline this. And when I put down the phone, I felt so empowered. I felt liberated. So there is so much in the power of no, and the rushed woman syndrome is actually to our detriment. I'm reading this book by Gabor Mate called The Hidden Cost of Stress.
Right.
So I talk to all of my patients about this. And so you asked me what I do. I do aesthetic medicine, but I'm very much a huge believer that our patients are not just walking, talking nose or skin or a pair of lips. They are a full person, and I need to understand the person behind the smile. And that means getting to know them and understanding what else is going on in their life at that particular time. What are they eating, which will contribute to their aging process? So I always say there's no body without mind and no mind without body. And that is what I learned from that doctor over 10 years ago. And again, that really shaped my practice. So my practice in Liverpool, I have these 5 suites. I have a skin suite where we perform all of our skin analysis. We're very scientific. So we will look at objective measurements of skin health, pigmentation, inflammation, pores, etc. Then we have a wellness suite where we perform wellness treatments like low-level light laser therapy to reduce inflammation in our patient's body, lymphatic drainage. We have a sculpt suite where we do our body sculpting procedures. We have a smile suite. We've just opened a dental clinic where we perform facially aesthetic-driven dental treatments. And we have an aesthetic suite where we do all things aesthetic medicine. But what I don't do is I don't do trout pout. No. I'm the wrong shop for hamster cheeks. Yeah. If that's what my patients want. And when I first moved to Liverpool, that was the thing here that was very, very different to what it was in London. And I quickly made a niche of that's not me. And I do full face harmonization. That means, I say if patients come in asking for big lips, because it's a trend, it was a fad at one point, right? I always say, okay, well, why? And then I look to see who else they hang out with, because there is something called aesthetic blindness. We can often start to want to look like the people we hang out with. And people don't see what they look like 360. They see what they look like in a picture. So they don't often realize that they might look unnatural or have distorted lips, for example. So it's a real education piece when they come in and we talk about full face harmonization. I say to them, listen, if I tried to take Angelina Jolie lips and put it on my face, I would look ridiculous. So it's about optimizing our patients. So our tagline, our ethos is on my wall. It's been on my wall for the past 4 years, which is radiance on the outside, wellness on the inside. And that's what I do.
Yeah, that's absolutely great. And I completely agree with you. I went for a consultation last night. Pretty sure you'll know her. The lady I went to see. She was great, really nice. Very much same ethos as you. You probably know her. She's called MJ.
Oh, yeah.
Yeah. Nice
Yes,
lady, yeah. And again, same. It's like I go in there. I don't go in and say I want my lips done, because it's almost like I want to look a little bit fresher.
Yeah.
So where do we begin? And she's like, we could do this. You could do this. You could do this. And it's all like, and I think that's the best way to approach it.
Yes.
It's a more expensive way to approach it, but if you want that balance all over, there's no point in putting like big cheeks in or filler in your cheeks, but then your chin is off balance or your nose is off balance or whatever.
Totally.
It needs to be kind of, that whole 360.
Yeah.
Well, this is what I would do to make it kind of, I don't know, how do you...
Balanced.
Yeah, balanced. Okay,
right?
so
proportions.
when you are looking at a patient's face and in terms of balance, what are you kind of looking for? Are you looking for this perfect golden ratio or...
Look, the golden ratio is an objective analysis. I know MJ well, and her ethos is very much the same as mine.
Yeah.
She's an ethical practitioner. So I know that what she won't do is just what the patient comes in and asks for. Because sometimes, patients might ask for huge lips and it won't suit them. So when we are looking at facial proportion, the golden ratio is the 5 proportion ratio. That is an objective ideal. But nobody is an ideal. And I think there's beauty in all of our individual differences. And I actually reject the philosophy or idea that all of us need big cheeks and tapered chins and massive lips. We don't all need that.
No.
And there's beauty in our differences. So what will suit one person may not suit the other. And also what one person may want might not be what the other person wants. And it doesn't mean, beauty is in the eyes of the beholder. So you got to work with what the patient wants. And I don't go towards an objective ideal. But when I'm doing my facial assessments, I look at 5 things. First and foremost, I start with skin. Skin is your largest organ. It's what our patients see on the outsides, right? And 99% of patients that walk in my clinic are using the wrong skincare. They don't actually know how to formulate their skincare, and they're getting their advice from skinfluencers on TikTok. And it can be really confusing. So we look at skin. I look at any inflammation in the skin. I look at pores. I look at laxity. I look at evidence of collagen loss, evidence of hyaluronic acid loss, evidence of elastin loss. And then I look at facial shape. And when I'm looking at facial shape, I'm looking at volume loss. Volume loss will happen with aging. It's inevitable. Everyone, man, woman, will go through that. Even the queen and the king. Yeah. So, no amount of money will stop that. And it's a normal physiological process. And what will happen is your fat pads start to shrink back. And that means that the support system for your skin starts to go, right? Also, your bone resorbs. Your bones become weaker from top to toe as you age. And in the face, they also shrink back. So the bony hole around your nose is called the piriform aperture. It becomes larger. So people start saying, my nose is getting bigger, my nose is dropping. The bone along the zygoma or the cheeks start to shrink back. So people start to say, oh, God, these hollows under my eyes, or flattening of my cheek. I'm starting to get these lines from my nose to my mouth. I'm getting shadowing from the corner of my mouth down. So we're looking at that. Jowling. A lot of jowling is very, very classic of women 40 and above. And again, that is normal. And that happens not just because of the fat, not just because of the bone, but also the muscle. People ignore the muscle. They don't even understand that there is a whole set of muscles in the face that are there and important for facial expression and for mastication, eating. So they become looser with age, more in women than in men. So we look at what's happening with the dynamics of the muscle. And I'm assessing that while the patient's talking. They don't even know, and I'm looking at them.
Okay, great. I feel like you're definitely assessing me right now, which is great. Carry on. I like you. I went home last night. I was chatting to my boyfriend. I said, oh, this is like what am I thinking of having? And he was like, why don't you just get a facelift? I was like, right, okay, that's big. So he is not somebody who believes in filler. Yeah. He's like, do not touch filler. I'd rather you have a facelift.
Yeah.
I was like, right, okay.
I get that. And like my husband is the same, but that's because bad news makes news.
Yeah.
And so what we have seen in the news or in the press is Leslie Ash's overfilled lips.
Yeah.
Joan Collins, Michael Jackson. We've seen the extreme. And so people think when you have filler, you look extreme and you look distorted. And the reality is so the opposite. If you perform it correctly, and less is more. And that's why I'm not a big filler. I don't do lots and lots of filler. I will sit back and I will look at my patient's face. And so we'll look at the muscle, we'll look at the facial shape, we'll look at the proportions. So is the face well proportioned or not? And I look between the upper face, mid face, lower face. And then I look also on the side angle. So is the chin underdeveloped relative to the
My
nose?
chin is underdeveloped. We assessed last night. Yeah, that could do with. So in line with my forehead, my nose, it is slightly reduced.
Yeah.
So yeah, that was one on the shopping list.
So a lot of patients will come in. I do a lot of non-surgical rhinoplasties. I do a lot of reconstructive facial aesthetics because my background was in head and neck surgery. I did that for 3.5 years, where we were breaking people's bones and fixing them. And then I thought, well, actually, I'm sure we can do this less traumatically, which is why I kind of specialize in facial reconstruction. And when they come in and they say, I hate my nose, or I've got a big nose, and I look at them, often they don't have a big nose. It's that their chin is underdeveloped. And if you have an underdeveloped chin, that creates the illusion of a big nose. So it's all about proportion. How do you
get an underdeveloped chin?
Congenitally, you're born with it. Mum might have had it, dad might have had it. So it's just hereditary.
Yeah.
And you can have mild, moderate, severe. Severe are patients who might have, their mouths don't meet at rest, their lips don't meet at rest, and they have to force their lips closed. And so they are carrying a lot of tension in the lower face. Sometimes they start to grind. At night, they're drooling on their pillow. They have dry mouth. These are all the functional impacts as well. And then lastly, I check expression lines. So, are they frowning, raising the eyebrows, smiling? Where are the expression lines? And then we formulate a plan. And my plan often starts with prevention and regeneration. Filling can happen at any age. You can have filler when you're 60, but you cannot regenerate when you're 60. It's kind of like the menopause.
Yeah.
Once you've gone through the menopause, doesn't matter if you find the best doctor in the world and you pay them millions. Once your eggs are dried up, they cannot make you have a baby. Right? And so I say this to my patients as well. Once after the menopause, your estrogen, your progesterone, and your testosterone goes down significantly. You lose 30% of collagen in the skin. You lose elastin. Your hyaluronic acid becomes disorganized. It doesn't become less, it becomes disorganized. And so you have dehydrated skin, you have redness, you have open pores, you have laxity. Your fat pads start to change. Your fat pads actually get larger in the jowls, which is why women go, oh my God, what is my jawline? Yeah, what's with my jawline? So I always say, look, let's deal with this first. Let's treat the jowls. Let's tighten up the muscles. And let's do that without filler.
How would we tighten up the muscles?
So you can use something called high intensity focused ultrasound or high intensity focused electromagnetic stimulation.
So basically like laser?
No,
or like,
it's not. It's known as HIFU.
Okay.
And there's different types of HIFU out there. And
I've had that. I've definitely had HIFU. I had it all over my body.
Okay.
She did HIFU on my face and then she did body contouring at the same time on my bum.
Okay.
And like back and everything, yeah.
Okay. So there's a lot of different I don't like to use the word HIFU because it's kind of like saying wine. I mean, I don't drink, but I know that there's hundreds of types of wines. There's good quality and bad.
Yeah.
So with HIFU, which is ultrasound, we've used ultrasound in medicine for years, right? So we use it to look at babies and women's abdomens or lumps and bumps. Ultrasound is sound waves, and when you use very focused rays of ultrasound, you create heat. And heat in a muscle, if you think of a steak on a pan, the steak under heat shrinks. Mm-hmm. So the idea of HIFU or high intensity focused ultrasound is it will shrink and tighten up that muscle to its pre-position because it will get lax with time. So if you think about a muscle that goes from the cheekbone to the lip, if that becomes loose, your lip starts to descend and you get these you look sad.
That's what's happening to me. I know it. So I don't know if I'm just permanently pissed off or like... But yeah, do you know what I mean? Like I'm definitely noticing it. When I'm like kind of like doing these podcasts, there's nobody who rips their face apart more than me. Yeah. All I do is watch back on this camera on YouTube and I go, look at that, look at that, look at that, which is what prompted me to go and have the appointment that I had last night anyway.
I get it. We're our worst, biggest critics, right?
Of course, yeah.
And now
I'm like, oh my God, I need like 25 grand at minimum to sort myself out.
I think it's important to understand it doesn't have to be crazy expensive. And I think, again, so this whole concept of HIFU is very, very effective at lifting the muscles. It's one of those treatments that I say to my patients who are 35 and above, that is worth your investment. But not all HIFUs are the same. And in fact, some are very dangerous. So, good HIFU is going to be an investment. And the reason why...
What we're talking investment-wise?
You're probably looking at 1,500 per session, and you need 2 to 3 sessions, depending on which one.
Would you not be better getting a facelift then, a deep plane facelift at some stage, tightening the muscles?
Well, you can, right? So a facelift is not tightening the muscles though.
Okay.
A facelift is repositioning the muscles.
Yeah.
It's removing excess skin. And what will happen, first of all, a good surgeon, I know fantastic surgeons, are going to cost in the tens of thousands.
Yeah.
I mean, the best one that I know is about £60,000. So it's a huge investment, but it's absolutely fantastic. Now, even if you had a facelift, is it going to replace lost volume? No. So it's not going to, no surgeon is going to be able to replace the bone structure loss or fat loss.
I see a lot of women like taking fat out their ass and putting it into
fat
their
transfer.
face.
So fat transfer works beautifully, but even that will age.
Yeah.
So you can have surgery, but don't think that that's the end point. You know, so many of my patients come and see me after having a facelift and they look great, but they're still aging. There's no pause or stop button. They're still aging. So they may need another facelift in 10 years. So with regards to the device-led treatments, there are some copycat machines which are dangerous. And I've heard of people having, 100 pounds of pop HIFU, which is don't touch it with a barge pole because that kind of, and they say, oh, you need 10 sessions. Actually, continuously putting heat in the muscle that many times will cause scarring and that will result in laxity. So they are not all equal. It's like an Argos Hoover or a Miele or Dyson Hoover. A Miele or Dyson Hoover, you go out, you hoover what you need to, you're done once, done. With an Argos Hoover, you're there for ages trying to get the stuff, right?
Course,
so the output is different. So
same with supplements.
Definitely.
We talk about this on this channel all the time. Not all supplements are made the same. Most of them have got like talc in them or whatever. Majority of the pill will be that.
Yeah.
And then you get some that are like really packed full of great stuff. Quality ingredients. Yeah, and you're going to pay the price for that.
Exactly.
Premium
Quality.
Exactly.
Quality costs.
Yeah, absolutely. Okay, so if you're over 35, that would be a great way to put that into your regime or put that into your annual bill for general maintenance. Yeah.
So, I mean, when I prescribe HIFU for my patients, or I use a device called Ultrasound, that's my favorite.
Yeah.
Because it doesn't cause fat loss and it's not painful. I don't like putting my patients under pain. That once we do that and they have their treatments, I say don't repeat this for 18 to 24 months. You don't have to have it annually. It's the same with fillers, really. Once you get to where you want to go, good fillers last. We now know that fillers can last 10 years. And that's why it's really important to find someone who understands science, anatomy, and also is artistic in their approach. Because when I'm putting fillers in someone's face, I don't just think, look, there's a quick buck, see you later.
Absolutely.
It's how is that going to age with that patient?
Yeah.
And I've been doing this for long enough. I've been doing this for over a decade. I have aged with my patients as well. So what I did 10 years ago, I'm seeing now. What I do now, I'll see in a decade because my patients become my friends. I see them, I hold their hands through when they're finding their boyfriends to when they get married, their first children, their divorces. We hold their hands throughout all of that. So I never think short term, I think long term, which is why fillers are not your first
port of call.
It's not your first port of call. And you can do fillers unless you have severe volume loss, or unless you have something that we must reconstruct with fillers, like a weak chin or dorsal hump deformity of the nose. Fine, fillers, absolutely. But if we've got volume loss starting, if the collagen is starting to go in the skin, then I would go down regenerative medicine pathway. Because I want to start to stimulate your own cells, your own body to work in your favor. And then we can pick up fillers later. So I'm talking things like Sculptra, Radiesse, polynucleotides. These are injectables that will literally rewind time. They will reverse aging in the skin. And when we're talking about aging in the skin, it's not just aesthetic. It's not just how your skin looks. It's your skin's health. Your skin is an organ, which is not just a barrier. It doesn't just keep the good stuff in and the bad stuff out. What you put on your skin, you absorb. Even your makeup, you're absorbing. You're absorbing your SPF, everything, right? So it's very important to understand that and understand that the skin has huge, important function for regulation of temperature, for wound healing. And so therefore, when we're talking about aging now more so in medicine, we're starting to view it as not a disease, but there is something called age-related disease. And I'll give you an example. Alzheimer's and dementia are age-related diseases. Diabetes, even certain types of cancers are age-related disease. So as women move into the perimenopause and the menopause, they will lose collagen, they will lose elastin, which impairs their wound healing response, impairs their ability to heal quickly. They are more prone to get things like basal cell carcinomas, squamous cell carcinomas, hyperpigmentation because their melanocytes are not working properly. So when we're talking about regenerative medicine, we're talking about enhancing the health of the skin, reducing the age-related diseases that come with it.
Right.
Make sense?
Yeah, absolutely. Yeah, I could listen to you all day, to be honest. I'm thinking, right, okay. Apologies for interrupting this podcast, but I need to ask a favour. If you're enjoying this podcast so far, then please hit that subscribe button right now. I'll be straight up and honest that I want to see this podcast grow and flourish into something that I'm really proud of. And the only way that I can do that is with your help. So if you've ever learned anything useful from these conversations, then please return the favour by liking, rating, subscribing, and maybe even sharing it with your friends. Thanks very much. Let's get back to the episode. Right. Brilliant. Okay. So Sculptra, just to pick you up on that.
Yeah.
So that's an injectable that you would put into the skin. How does it regenerate the skin?
It's amazing, isn't it? So Sculptra is what we call a polylactic acid.
Okay.
When we inject that into the skin, it stimulates inflammation, actually. So short-lived inflammation, which then induces the wound healing response. So the body responds to that inflammation by laying down lots and lots of new collagen, but also you get recruitment of new, what we call fibroblasts, the cells that make new collagen. You also get recruitment of new blood vessels. So we call that angiogenesis. And so it brings all of this good stuff back to the skin. And you get tightening, you get improved pores, you get improved pigmentation. The actual density of the collagen in the skin improves, and it lasts up to 2 years. So it's a really, really great treatment option in our toolbox for patients who want to regenerate skin. And I think, and again, I'm a big believer in regenerative medicine. I think if we can regenerate tissues, fantastic. But it's not for everyone.
No,
if you have an
absolutely.
autoimmune condition, there are risks of developing an autoimmune response to Sculptra. So we've got to pick the right injectable for the right patient.
Yeah.
Another one
And
is
then where would you inject it?
So you can inject it on the cheeks.
Yeah.
You can inject it in the temples. You can inject it in the lower face. You can do it to either create a lift.
Yeah.
And so if we're trying to create a lift, we inject backwards. So kind of if you draw a straight line down from your eye, from the outer corner of your eye, we call that the lateral aspect of the face. If you're injecting there, think about it, you're going to get a lift like this, right? Or you can inject it to create volume. So you can inject it in the cheek areas to get more volume, or along the chin or along the nasolabial fold for a kind of more plumping effect. And then there's another one called Radiesse. Have you heard of Radiesse?
No.
So Radiesse is a calcium hydroxyapatite. It's the same thing that comes in your bones, so to speak. And it works in a different pathway to Sculptra. And it's not that one is better than the other. People ask me, which one do you use? I say both, depending again on the patient. Sometimes both on the same patient at different stages. So Radiesse, when you inject it, it leaves little spheres of calcium hydroxyapatite under the skin. And then collagen comes and sticks to it, and you get a recruitment of new collagen. And you can use it for filling, so for volumization, but you can also use it, again, for recruitment of collagen. And then there's polynucleotides, which are the latest one, which come from fish testicles, fish sperm, which everyone goes, huh? Which is really bizarre, because I don't know who thought, let's just take some fish testicle and inject it in someone. But we know that these things stimulate, again, the wound healing response. So when we inject polynucleotides, which are little strands of DNA from fish, the body responds to that by laying down new collagen. So all of these are collagen stimulation injectables, which I feel the industry is massively moving towards. And again, what we find is not just an improvement in aesthetics, but an improvement in the regulation, the differentiation, the cell signaling, because your skin talks to each other. So the skin cells that sit next to each other, they talk to each other. And that's why, have you heard of senescence or senescent cells?
No.
So as you age, the cells in your skin start to age as well. And the skin is interesting because when it ages, when the skin cells start to die off or age, we call skin cells or any cells that are dying, we call them senescent cells, so they're age cells. They start to leak out negative messages, which tell their neighbors, hey, we're aging, let's switch off. Right? And let's start to create some disease. And then you get a bit of pigmentation, you might get a little bit of collagen loss, you might get cancer. These are all negative messages because they're talking to each other. In the skin, senescent cells stay there. They don't just die and leave. In other areas of the body, when you have age cells, they die, they leave, and they regenerate. But in the skin, they stay there. So when we're talking about regenerative medicine, we're talking about cell signaling as well. We want the messages and the signaling that's happening between the two skin cells to be positive. We want them to empower each other to have healthy skin. We don't want them to switch each other off.
Yeah.
And actually, it's like, if you think about it, the saying of, what was it? Bad apples, rotten apple spreads, right? It's the same thing with skin. If you've got bad, unhealthy skin sitting next to another bad, unhealthy skin, it spreads. So you want to stop that. And that's what regenerative medicine does. Cool, huh?
Yeah, very cool. Yeah, I feel like we could unpack that all day long. Okay, so anybody listening to this, and I'm sure we'll have swathes of women listening to this, and they're going, oh my God, I need Sculptra. What are we talking price point on that?
That's going to differ clinic to clinic.
Is it like you buy it in a vial, I would imagine?
You buy it in a vial, yeah. You're talking usually somewhere between 500 to 600 pounds.
Yeah.
Yeah.
Okay. And it lasts about 24 months?
Yes.
Yes.
And that's the great thing about it. It's not something that you might need 2 or 3 sessions to start with, but it's the gift that keeps on giving. It does last. I love it. I think it works really, really well in the right patient.
Yeah. Okay. I mean, last night I was like Googling blepharoplasties as well, because one of my friends has just had one.
Yeah.
She publicly acknowledged she'd had one, and she's actually coming on the podcast, and she cancelled the podcast because she was having her eyes done. So I was like, okay, we'll get you in later on. So I'm dying to see them.
Yeah.
But that was something else. I was thinking, should I have that done?
Okay.
Would you be awake or close? Would you
be awake with blepharoplasty?
Yeah.
You can do either. It's not as traumatic as you might think, a blepharoplasty in the right surgeon's hands.
For anybody who doesn't know what blepharoplasty is, it's this piece of skin here that they can take out, and then you look like you've got more open eye.
Yeah, exactly. So it treats excess or lax skin of the upper eyelids. And it's a great procedure. But again, you will still age. So you might have one now when you're...
And you might need it again in 10 years.
You might need it again in 10 years. So look, surgery is great. Surgery is there for those who want it. But what we know is non-surgical interventions have massively increased because there are great alternatives for people who don't want to go under the knife, who might not be able to afford going under the knife, who don't want the downtime, who are busy, who are afraid of general anesthetic.
Yeah, and like...
complications.
Absolutely. I mean, and that's not to say injectables, there's no complications with that either. I mean, I have had nose filler in the past. I really liked it and would have it again, but obviously it comes with risk. It's actually the riskiest place to put filler, so it scares me. But also the thought of surgery also scares me.
Yeah.
So it's just like big psychological and emotional investment to have something like that. And you're putting your trust into somebody, and, you know, we're talking millimeters.
Absolutely. I mean, 30% of my patients are patients who are post-operative. That means they've had surgery and either had surgery gone wrong or want to improve on their end results.
Right.
So here's the thing with surgery. As I said, it's great and you must find a good surgeon. But when you wake up, you are stuck with what you have, right? If you don't like your filler result, you can dissolve it.
Yeah.
If you don't like your surgical result, what are you going to do about it? You're going to have to go and have filler to correct it, or you need to have a second surgery or revision surgery, which becomes more complex each time.
Yeah.
And then there's a 1 in a million risk you won't wake up. I mean, that's very rare, but these are complications that patients must understand.
Yeah.
So there's a whole host of things out there patients can have. I love non-surgical, but I'm not saying that one day I might not have a facelift. I'd lift and tuck what I need to in the future. But now I am lucky because I can access body sculpting treatments that are non-surgical. You know, for the eye, we do non-surgical blepharoplasty with ultrasound. You can also have microneedling radiofrequency to stimulate collagen. So for some patients, they come and say to me, I don't want injectables. I am not injecting my face with Sculptra or Radiesse or fish sperm. or any filler. My husband's dead against it. I'm dead against it. I want a non-toxic lifestyle. No issue, fine. Let's do HIFU. Let's do microneedling radiofrequency. Let's do fractional laser. There's so many options out there.
Yeah, absolutely. What do you think of like plasma treatmens?
What do you mean by plasma? Because there's a whole host of different plasma treatments out there. There's AgeJet, there's Neogen, and then there's the old Plexar plasma pen, which I think needs to go in the bin. I think it's really dangerous, actually.
Right, okay. Is that like that little dots?
Awful.
Right, okay.
Absolutely awful. Do not do it. That is a treatment that became very popular back in 2016 and is still quite popular in Liverpool and can cause permanent damage to the integrity of the skin. And I have seen so many women with permanent scarring, especially young women. And they have these, you'll have seen it on Instagram, little dots where the skin is ablated or burnt off, and they're left with indentations for the rest of their lives. And usually it's the younger generation that are having it. Or I would say a little bit more price-sensitive patients who might not want to have CO2 laser and think that this is an easier way. Actually, it is awful. It is something that I wouldn't touch with a barge pole. And I would, if I want to give one message out, is that has real potential for permanent scarring. I'd be very, very cautious of that.
Because I see like videos and it actually does like suck the skin in.
Contraction.
Yeah.
Well, of course, because you're ablating, you're burning a little piece of the skin. But the potential
that's just
downtime,
kind of like superficially doing it. It's not like doing it from the inside, which is what you would recommend with something like Ultrasound.
Yeah, so Ultrasound tightens the muscle, right? So each treatment that I prescribe targets one of the 5 layers of the face. Your face has 5 layers: skin, superficial fat, muscle, deep fat bone. If you're only doing skincare, that's fine. You'll have nice skin, but you're still going to have fat in your jawline. You're still going to have lax muscle. Like, and I think we need to be really real about that. I think what's really not helpful is women going, I just do skincare. No, you don't. I know, because you're my patient, So I see this, and I get that there's a stigma, and I get that people don't want to talk about it. But actually, I think if we want to break down the stigma associated with aesthetic medicine, we need to start getting real about it. And I find this really fascinating because I see a lot of women who come to me and say, I really don't want my husband to know, or I don't want anyone to know, and I get it. And we treat them subtly. I don't want my husband to know. My husband's dead against it. So I understand. But that's a social norm. And I'll tell you what's not a social norm. With your dentist, for example, if you get your teeth straightened, your teeth whitened, composite bonding, you know what society tells people who have teeth crowding? They go, you should go and get that straightened.
Yeah.
You know what? I'll tell you who my dentist is. Here's a number.
Yeah.
Whereas I'm the best kept secret for aesthetic medicine because people don't want to tell other people that they're having filler. And again, I understand that, but that creates shame. It creates guilt. And it creates this feeling that I'm not good enough. How come she looks like that and I don't? It's not healthy and it's not helpful. And I find that when women are having, again, there's no shame with getting your teeth straightened, but the second someone's getting their nose straightened, it's, ooh, why are you having filler?
Yeah, or yeah, like kind of like, yeah, I get that. Or, I mean, I always talk about it. I've had plastic surgeons on this podcast. Yeah. We've talked about like facelifts, etc. Yeah. And yes, there is a bit of shame in it, but I used to say I had a plastic surgery fund. Like I have like a savings fund that I used to put in. Spent it all on a house, unfortunately. Yeah. So I need to really sell some golden pills to replenish my my plastic surgery fund. Yeah. But I mean, I also did a live with a plastic surgeon in New York. Crazy expensive guy. Very good though. So he is, do you know Andrew Giacomo?
Yeah, of course.
Yeah, okay. So his protege. Yeah. Great guy called Sean. Yeah. So did a live with him. We're basically saying that like PDO threads are not the way to go. Like
absolutely
stay
not.
Away from them.
Away.
And also acrylics, things like that.
Hate
like
it.
Absolutely awful. Yeah. So we're doing, and like actually what we were saying, in these situations, it's probably best to go pro surgery.
I agree.
Then have threads.
Totally.
I mean, there is a clinic in Manchester. I just don't know how they're getting away with it because who literally Photoshop all their after pictures to make them look like they've lost about 10 stone in a half an hour appointment.
It's really bad. Look, our industry is very unregulated, which means every Tom, Dick and Harry can, like your plumber can go on a day course the next day and start saying, I inject filler, that they're buying off eBay and injecting into people's faces. It's really scary.
Could I just ask you about something that's really trending on TikTok right now? Lemon bottle.
Oh no, I've not seen that.
What? Oh my God, let me tell you. Okay, lemon bottle. Because I'm seeing injectors going, we're offering lemon bottle. I was like, what's lemon bottle?
Right.
So I sat there in the hairdressers as everybody around me was talking about it. I'm a journalist first and foremost. So I said, you can't even tell me what's in it. So therefore I'm already like on the back foot. So I start looking into it. I think the enzyme that's in it is bromelain, which is like a pineapple enzyme, obviously on steads, basically. So that's what they've done. And apparently if you inject it, then it dissolves fat. But I was like, okay, let's have a look. So I found the clinical study, I'm reading the study. Oh, lo and behold, it's been done by the person who's invented lemon bottle, basically. Yeah. So I was like, therefore we can't trust it.
Absolutely.
Yeah. So the results look really good. I am in complete disbelief that it would work. And I was like, if you inject, who knows where you're injecting when you're injecting if you don't know, if you go into the hairdressers and they're injecting you with lemon bottle, like, where are you going to be putting it?
I mean, there's so much to say about this. First of all, you should not be having injectables in a hairdresser, right? Yeah. Go to a Care Quality Commission regulated medical facility, first and foremost, right? I wouldn't have my big toe injected in a hairdresser. And I've got 10 toes.
The thing is, anybody can buy lemon bottle, right? You're going to have to look into anybody can buy it. I could buy it right now. Yeah. Because you don't need to be an injector to buy it. Yeah. So
that's crazy, isn't it?
It's not regulated.
Yeah, it's crazy.
So this is just literally off the shelf. So anyone can buy it on eBay. Anyone can buy it over on their website, whatever. So it's become a huge TikTok trend. And obviously all you're seeing is, and apparently it doesn't really hurt. It's not like acrylics or anything like that. It's like, it doesn't, there's not much downtime. You don't really hurt. And I'm just seeing it everywhere. People injecting their abdomens with it, the back of their arms, their chins, everywhere.
Right. Let me say something about this. I have been...
Cut our coughing out, will you, Calvin, all the way through?
So I've been around long enough to see trends come and go. And this will not be the first trend nor the last trend. I remember Russian lips, Barbie Botox just finished,
Trap talks. Ridiculous, yeah.
Absolutely ridiculous. And acrylics was a huge trend at one point. Yeah. There are trends that will continue to come and continue to go. And when I am lecturing, when I'm teaching, and I teach only prescribers, I always put a picture up of Michael Jackson, Joan Collins. I mean, no disrespect to anyone, but I say the
I think Joan Collins looks amazing.
Well, it depends, right? Depends on.
I mean, she's 90.
Yeah, but sometimes we can go too far.
Yeah,
and we can start to cause distortion of the tissues. Maybe I'm not thinking of Joan Collins. Maybe I'm thinking of someone else.
I was going to say
Versace. Sorry, it's Donatella Versace.
Like Joan Collins looks amazing and pretty natural to me. Donatella Versace.
We're gonna have to cut that out. Donatella Versace.
Yeah, switch out Joan Collins because she's my fucking hero.
So what I think went wrong with Michael Jackson's Donatella Versace is they went too far, too much, and the practitioner didn't say no, and they can fall into trends and fads. Now, you have to know when to say no. You also need to know how to analyze critically appraised data. When I'm a scientist. I am a scientist first and foremost. So when my girls come and say to me, oh, this is going on, I go, hold on. Is this fact or feeling? This is my constant thing. Fact or feeling? There are 5 levels of clinical data. The weakest form is opinion. The strongest form is something called a randomized control trial, which is where you assess if there is clinical efficacy of a specific treatment by comparing 2 lots of patients who have had 2 lots of medication, one, and it's placebo and blinded. So you don't know what you're having. Double blind,
better. Yeah.
Okay? So double-blind, placebo-controlled, randomized control trial, we're talking top of the top. Yeah. And a meta-analysis, even better. If you're coming to me and you're saying to me, this is a study done by the guy who did it and he's saying it works, that's not clinical evidence.
Exactly.
And I see a lot of people claiming things. This is the best treatment for fat reduction. Says who? Where is it? Show me the evidence. Retinoic acid is not good for you. Says who? Show me the clinical evidence. I'm done with opinion. I don't want opinion. I want facts. I'm duty bound to recommend things in my clinic that are evidence-based. And that means they are backed by robust clinical data, not just opinion, not one flimsy study done by the person who's made it. That is not good enough.
No, absolutely. And you know what? This is something that I'm really passionate about. I mean, I have got lots of studies, we list them on the website, about the ingredients that we use in Elle-Sera. So maca, tribulus, ginkgo, whatever.
Yeah.
And then we get some people who go, where's the randomized controlled studies on your product? I'm like, okay, well, here's them all on the ingredients, because you know how much that costs for me to be able to do that?
Yeah.
In fact, go after the big brands and they don't even do it. So, but I'm like, there's all the human trials and this is the gold standard. This is a double-blind, randomized, controlled study
on these
where they've given
ingredients.
Tribulus to women post-menopause who've got sexual dysfunction. And there we go, 93% of them saying Tribulus is amazing for their sex drive.
Yeah.
There you go. And then they still, I'm like, who are you anyway? Do you know what I mean? Sometimes I'm like, oh my God.
Yeah. But some people don't speak science, right? They speak TikTok. That is their language. And that's okay. But maybe this, your vibe attracts your tribe. They're not your people.
No, yeah, absolutely. So talking of studies, you did a study yourself into perimenopause and menopause.
Yes. So this was a huge study. It was a survey of over 2,000 women in the UK. And the reason why behind this study is because, and you asked me earlier what I do, and I told you aesthetic medicine, but I really take time getting to know my patients. And as I said, I've aged with my patients as well. I'm not 40 plus yet, but I'm approaching that rapidly. And what I would find is women would come and they sit in my chair as they were approaching 40 or in their 40s, and they'd be like, oh, I looked in the mirror, I've lost my mojo. And they're still holding back. And I'd be like, okay, what else is going on? And there's a reason why they're holding back. They're holding back because of shame. They're holding back because of guilt. And they're holding back because they don't think it's relevant to aesthetics. And so we break down, and I'm really passionate about creating a safe space for patients to talk. And eventually they'd say to me, they'd break down, they would cry. And they'd be like, things are just not going well at home. I'm like fighting with my partner. I've got brain fog. I'm overwhelmed at work. I'm anxious. I'm not sleeping well. I'm just not in a good place. And they haven't connected the dots that actually this could be secondary to a hormonal imbalance. And so I am thinking, right, filler is not the first thing that we need to do. We need to talk about hormone balancing, right? And that's the idea of holistic healthcare. And then they'd go off and we'd put them on something. Then they'd start their hormonal rebalancing journey. And they'd come back 6 weeks later with their mojo back. But I would see this continuously. So, and I'm talking about 9 a.m. patient, 10 a.m. patient, 11 a.m. patient throughout the day. By the end of it, I'm like, oh, and all of them feel lonely and guilty, and they think they're the only ones in the world. And I say to them, have you spoken to anyone about this? And they say, oh, I went to my GP and they gave me some antidepressants and told me to crack on, love.
Antidepressants, that first port of call, because it turns off like one pathway that might stop a hot flush, but literally causes so many other symptoms like loss of libido, appetite changes, nausea, whatever. It can. For me personally, really the side effects don't outweigh what it can help.
So, clinical depression, of course, may need medication at some point, but that's different to perimenopause. Perimenopause or menopause is caused by a reduction in estrogen, progesterone, and testosterone, which has over 38 different symptoms, one of which is anxiety, one of which is depression, low mood, etc. And unfortunately, what has happened is, and I'm not taking a dig at any of my colleagues that are doctors, but unfortunately, for a long time, patients were being treated as symptoms. So, oh, that's your symptom, here's the medication. No, you're not joining the dots and you're not treating them holistically. And actually, their feelings of low mood are secondary to a hormonal imbalance. So let's talk about that. And so, we would connect the dots. And then I thought, wouldn't it be great if the 9 a.m. patient knew that the 10 a.m. patient felt the same and the 10 a.m. patient knew that the 11 a.m. patient felt the same. So that's why I did the research, and we surveyed over 2,000 women. And I have patients who've gone through the menopause at the age of 16. So there's something called premature menopause or ovarian insufficiency. And it can happen at a very young age. And it's a very, very difficult and very lonely place for women to go through, because when they're 16, 17, 18, their friends are talking about their periods. When they're 25, their friends are having babies. And they can't share what they're going through because they don't get it. They're already suffering with hot flushes. They're already suffering with vaginal dryness. They're already suffering with loss of elasticity in their skin. So we looked at all of these women who went through the perimenopause, and we asked them about the physical symptoms, and we asked them about the psychological symptoms, and also how skin aging made them feel. And it was really, really interesting. And I'll just tell you some of the key, for me, stark things that I found. 63% of women had no idea that the signs and symptoms of the menopause can start 10 years before their last period. And that's what we call perimenopause. People think, oh, perimenopause when I'm kind of around the year that I'm losing my period. No. Perimenopause can start at the tender age of 35.
Well, I was thinking in my head, 42.
Yeah.
I mean, in my head, I'm thinking I'm going to be perimenopausal about 42. I'm 38 now.
Yeah.
My partner keeps saying, should we have another baby? I'm like,
Why not? Why not?
I don't know if I've had any time.
That's a conversation for after the podcast.
Yeah.
So, when I see a woman at the age of 40, I start to consider that they're approaching the perimenopause or they are in the perimenopause. It is because what doesn't happen is that you don't wake up and one day all your hormones stop. It is a gradual decline. And we know that testosterone starts to decline from the age of 35, which is going to have an impact on your libido, your energy levels, even anxiety and
cognitive
overwhelm.
function. Yeah.
100% brain fog. So they didn't know that. Then they felt I coined the term periscaries. So if you Google periscaries, that is the name that I came up with after looking at all this clinical data, because women were afraid. They are looking at the perimenopause and menopause with fear. They feel like they're going to lose their femininity. There's overwhelm and a huge amount of loneliness associated with that, because they think I'm no longer relevant. Once I go through the menopause, I'm not relevant at home. I'm not relevant in the workplace.
Well,
it's not true.
I agree.
That's how they feel.
Yeah, that is how they feel. That's every single customer we ever speak to. It's also like an overarching feeling as well. Yeah.
And I find that really sad, because so my whole ethos is empowering women. And I create what I call empowering transformations. And that means helping my women, helping the people that come to see me have their bounce in that step. So it's not just a physical change. It is a whole psychological, psychosocial, and emotional change. We found that women, over 60% of women suffered with anxiety. And more than 20% of women were saying that they wanted to kill their husbands. It's very normal to want to kill your partner during that phase. And men, if they understood that, they would not think that they've drawn the short end of the straw. If men understood what women go through, it would be a much less lonely place, because they would get it, right?
The problem is they don't listen. I think men have this inability to listen. I know from personal experience.
Yeah.
They'll jump to the end of what you might, how do we fix it? Hang on, I haven't told you how I feel yet.
Yeah. They don't get it because they don't.
We've missed out 6 hours of this conversation. You've gone to the end in 2 minutes.
Yeah. So they don't get it. But this is why we created, so there's a report that I created. I had 20 pages of clinical data. And I thought, right, this is so valuable. And and by the way, men go through it as well. Men go through a reduction in testosterone. We call that andropause.
And but a lot later.
Well, it depends. Some men go through it between the ages of 40 to 50, some men 55 plus. We call that midlife crisis, and they have their whole host of symptoms. So men are going through andropause, women are going through menopause or perimenopause, and they're fighting, and a lot of marriages fall apart during that phase because they go, you don't understand me, you don't understand me. And I think if people understood each other better, marriages would last a lot longer. So we created, and you can get this on the website, and I made it free, available free of charge. It's a full skin guide and a menopause guide. It's called Glowing the Distance Menopause Skin Report. And you can get it from the website, dryusra.com. And I would encourage every woman to do that, because we talk about regenerative aesthetics. We talk about Morpheus 8, microneedling. We talk about HRT. And I think if women know how to take preventative action, then they will not just survive their 40s, they will thrive in their 40s. And that, I think, is very, very important. And I think it's very important that we don't dismiss the impact of skin aging on women's emotional well-being. Looking good helps you feel good. And I will never say, oh, they're just being vain. It has an impact. That's why we brush our hair, we dye our hair, we put makeup on. Why not feel good on the outside? Why not have that bounce in your step? So I'm a big believer in, look, do what's right for you. But if you want to access treatment, then you should be able to do that unapologetically and without shame.
Amazing. Thank you so much for coming in, Dr. Yusra. I could sit and talk to you all day. I'm going to your clinic later on at 6:00 tonight for a lovely, wonderful talk to meet some other like-minded ladies. And I can't wait, to be honest.
Can't wait to have you.
Yeah, no, it sounds great. And I'm definitely going to get you back on again, especially when I see things popping up in the news. I'm going to be like, right, okay, let's do another podcast.
Let's talk about this trend.
Absolutely, yeah. So you need to go home and have a look at this lemon bottle. I want you to like give me the 411 on it, because then I can go back to everyone in the hairdresser.
Sometimes I see these fads and I'm like, oh, just another one. I know. Kind of just,
I know, yeah. Oh, well, thanks so much for coming in.
Thank you for having me. Thank you.